Professional colon hydrotherapy is the infusion of temperature control, purified, disinfected water for the sake of improving the muscle tone of the colon, improving peristalsis. It also reduces toxic waste, parasites, excessive bloating, and gas, but also for the sake of overall hydration. This hydration can improve the skin itself, reduce wrinkles, all sorts of beauty aspects as well. Personally, I believe that colon hydrotherapy has become so popular these days due to the extensive digestive problems that we have in this country. 90% of all emergency room visits are for gastrointestinal issues. Irritated bowel syndrome is one of the most prevalent causes for children and adults to stay home from either work or school. So digestive issues are a big problem, and colon cancer is currently the #2 cancer killer in the U.S. So obviously digestive issues are a big problem. Generally, individuals will find colon hydrotherapy extremely beneficial if they suffer from long-standing constipation, particularly for clients who have found fiber or chemical laxatives to be ineffective, in some cases actually make them worse. Things like just stagnation, poor peristalsis, gas and bloating, poor elimination in general, a slow transit time, things like maldigestion, allergies, both food and chemical and environmental allergies, believe it or not. Obviously fecal impactions, and for people with fecal impactions, they may actually get a prescription from their medical doctors. Parasitic infection, excessive weight, and the big one is fatigue and, you know, general malaise and a lack of energy and vitality. Oftentimes will be improved through colon hydrotherapy. Another big one is acne, wrinkles. I had one client tell me that her esthetician recommended all of her clients get colon hydrotherapy prior to getting facials. So as far as, you know, skin improvement, a lot of clients find it beneficial. For most people, colon hydrotherapy is completely safe. The two things that could potentially be lost during the process, for one is electrolytes. Most people just assume that the loss of electrolytes could occur because they make the assumption that colon hydrotherapy is similar to diarrhea. It is not. There's never been electrolyte loss proven in any study of colon hydrotherapy, but theoretically that could happen. The other thing that could potentially be lost is the friendly bacteria, otherwise known as probiotics, but you lose friendly bacteria in, you know, with a normal bowel movement. You know, they come and they go. But in our facility, we do offer both of those to our clients. They're available on request, you know, to minimize anything that could potentially be lost during the process. For most people, we do not require a prescription or a referral from your primary care physician. However, if you do have one of the potential contraindications for colon hydrotherapy, we will not do it in our facility without a referral or prescription on file. These primarily include things that could potentially weaken the walls of the colon, and they include things like Crohn's disease, colitis, diverticulitis, colon cancer, obviously, and any recent rectal, anal, or colon surgery. Another big one is kidney disease, you know, any type of renal failure, if someone's on dialysis. Lupus, just because frequently there is, you know, a diminished kidney capacity there. Acute liver failure, if they're currently pregnant. Abdominal hernia, just because the process is very, many people experience the next day like they were doing abdominal crunches. It does give you an abdominal workout, so for people with hernia it can kind of aggravate that. People that have had recent abdominal surgery for the same reason. Individuals with cardiac disease, aneurysms, people who have significant anemia that's unresolved. What else? I think that's basically it. Aneurysm, I said that one. Cardiac disease. But those pretty much cover the main one. If you have a potential contraindication, then we will need a referral or a prescription on file before we do the process. Obviously, we're not medical doctors, so we don't want to do anything, you know, that could potentially be harmful. But for most people in reasonably good health, it's very safe, and we don't require that. But if you're unsure, you can visit our website at www.internapure.com to get a list of the potential contraindications, and we will definitely work with your medical doctor to get that referral or prescription on file if you happen to fit in one of those categories.